Now, why not use a Dremel? All electric drills create an aerosol of bacteria and fungus and remain in the air for up to 30 minutes. The high-speed drills of today are great, but they do release the potential for getting hepatitis B, hepatitis C, HIV. Dremel drills recently have been banned from the VA for that reason. So the VA says, if you're going to grind, you need some type of a vacuum device to get the mist. OSHA recommends also having a vacuum device. This is a picture, it's hard to make it out, but it's the dust that gets shot into the air that you breathe in after you grind nails. These dust particles are small enough to deposit in the alveoli, bronchioles, and throughout the respiratory system. So it's been shown that podiatrists have 4 times the national prevalence of asthma, and there was a Miller postal questionnaire which showed 39% of podiatrists had rhinitis or allergies, 51% had eye problems, 18% had chest complaints, and 22% had skin problems. There was a 2008 guidelines written for infection prevention and control by an antibiotic task force. The purpose of their study was to make guidelines. It was targeted to the general family practice and to podiatry offices. The Centers for Medicare and Medicaid Services define routine foot care as the cutting of and removal of corns and calluses, the trimming of nails, and other routine hygienic care. But when a patient comes in with the onychoxic mycotic nail, that's not routine foot care. But they put in writing that there is an appropriateness for the room. So what's appropriate? Any room is appropriate for routine foot care, the trimming of nails, corns, and calluses. But a separate room should be dedicated to sanding and burring. And that's tricky. It's because of the aerosolization, contamination environment, the equipment and supplies in that room. It's there, and it builds up patient after patient. So they recommend to set up the room to make it visually clean and organized, to cover exposed items when sanding, remove or minimize room equipment, turn on an air filter, and use a sanding vacuum. There are a lot of vacuums out there associated with burrs. This particular one is being shown outside, and it happens to really be what you need because it has a great vacuum. There are special burrs that they have for diabetic care. They have a set of diamond burrs and carbide burrs, and B&A Burrs has their drill FDA registered. That's important because if asked in a court of law, what did you use? If you say Dremel, you've lost. So you really, in today's world, you have to have today's equipment. A Dremel drill doesn't make it. The advantages of a drill with a vacuum, obviously, it sucks up the